Check. Mic check. Mic check. Mic check. 1 2 1 2.
Hello, everyone. We're just running a few minutes behind because we have some lost families. So we will be starting shortly. Thank you for your patience. Okay. In that case, everybody take your spots. We're going to be standing while the graduates come in, while the graduates sit down. We'll sit now. Do you have a sign sheet? Yeah, you're the last one because you're doing the. making public health decisions on the fly. That's how we roll here. All right. Hello, everyone. We apologize that you're melting right now. So are we. I am Dr. Gomez. I am the MPH Campus Program Coordinator and the Graduate Advisor, and it is an honor to welcome you all to the celebration of our MPH graduating students. For the last several months, a committed group of students has worked hard to plan this event while also juggling classes with some of us faculty, full-time jobs, families, and the comprehensive exam. Please join me in welcoming our graduates. Our graduates and faculty will stand as some of our graduating students do our cultural greetings.
Welcome, graduates, faculty, families, and friends. Thank you for coming to our celebration.
به جشن فارغ التحصیلی ما خوش آمدید.
Chào mừng các sinh viên tốt nghiệp, giảng viên, gia đình và bạn bè. Cảm ơn các bạn đã đến tham dự lễ tốt nghiệp của chúng tôi.
Bienvenidos, graduados, facultad, amigos. Gracias por venir a nuestra celebración.
Thank you, students. Our faculty and students may now have a seat. A cultural greeting is something that's very special to our MPH program. We like to make sure that we acknowledge all audiences, all the languages of our graduating students and their families. Now I would like to call Ana Costa to the podium to read the land acknowledgement.
A land acknowledgement is a formal statement that recognizes the history and legacy of colonialism that has and continues to impact indigenous people, their traditional territories and practices. Acknowledgement is a simple, powerful way of showing respect and a step towards correcting the stories and practices that erase indigenous people's history and culture and towards inviting and honoring the truth. The ability to gather, learn, and establish our presence as an institution of higher education came at a great expense of the original inhabitants of this land, the Mawekma Ohlone tribe. Let us acknowledge with respect and reverence for the Mawekma Ohlone people who have stewarded this land throughout the generations while not forgetting the colonialism of this land. We acknowledge the land on which San Jose State University is located on was once the traditional home of the Thamian Ohlone speaking people and the present-day Mawekma Ohlone tribe. The Thamian Ohlone were missionized into both Mission Dolores, San Francisco, and Santa Clara. The present-day Mawekma Ohlone tribe is comprised of all known surviving Native American lineages aboriginal to the San Francisco Bay region, who trace their ancestry through the missions San Jose, Santa Clara, and Dolores, and the historic federally recognized Verona Band of Alameda County. In the Mawekma Ohlone language, Chochenya, Mawekma means the people. Without them, we would not have access to this gathering that we have here today. We take this opportunity to thank the original caretakers of this land. And now, Dr. Gomez will introduce the MPH faculty.
Thank you so much, Anna. It is with great honor that I introduce our faculty and chair. Faculty members, please stand as I introduce you. Dr. Rachel Berkowitz. Dr. Charles Park. Dr. Angie Buckner. And Dr. Marcel Dugan. Thank you for your round of applause for our faculty and for their efforts in guiding our students on their graduate journey. Thank you. Next, I would like to introduce Dr. Yoshi Iwasaki, Professor and Chair of the Department of Public Health and Recreation in the College of Health and Human Sciences here at San Jose State University. Dr. Yoshi will be sharing some words. Please welcome Dr. Yoshi Iwasaki to the podium.
Yeah, thank you, Dr. Gomez, and good afternoon, and welcome to our MPH graduation celebration. As I greatly appreciate feeling of excitement and vibrant energy in this room. So first, on behalf of the Department of Public Health and Recreation at San Jose State, I extend sincere congratulations to all of our graduates and their family and friends who come together to celebrate the great accomplishment of our graduate who have successfully completed top-ranked premier MPH degree from San Jose State University. So congratulations to all of you. Now, 2 years ago, we celebrated 50th anniversary of MPH, Master of Public Health, which has continuously maintained accreditation by CEF, which stands for Council of Education for Public Health, since 1974. And this year, we are currently completing comprehensive self-study, which is part of the requirement for CEF reaccreditation, not only to gather extensive data and impactful story to demonstrate excellence in our MPH program, but also to embrace and envision for the prosperous, thriving future of the program. And indeed, we are very proud of the legacy and impressive history of our department and programs who have generated increasing number of alumni who make a difference and have an impact on people and the community we work with within the field of public health and recreation. And through our extensive partnership with alumni and employers in our industry. And in particular, CCL, that stands for Career Connected Learning, is essential to our commitments to talent creation, which involves a variety of high-impact experiential learning, including internships, community service learning, and the translation research, and also, of course, professional leadership development, which is essential for our investment into creating a robust pipeline from higher education to workforce development. And central to this effort is our commitment to social economic mobility of our students, alumni, and their families that have intergenerational benefits particularly from DEI, diversity, equity, inclusion, and social justice perspectives. And on that note, I would like to express my sincere appreciation for all of our MPH faculty, of course, including program coordinators, for their program development, instructions, advising, mentorship, with their commitments to student success, community engagement, and the leadership and professional development. So accordingly, I would like to end by emphasizing that our commitments to building a community of public health and recreation department through nurturing our partnership and relationship with students continue as they graduate from our programs to join a very impressive, talented member of our alumni who have been playing leadership role in serving our communities, not only here in Northern California and across the state of California, but also nationally and globally as well. So we look forward to continue to partner with and engage a growing number of alumni to continue to build our legacy and enhance our commitments to serving the public good and humanity. So thank you so much for your attention, and once again, congratulations to all of you.
Thank you so much, Dr. Yoshi Iwasaki. I would like now to call graduating student Jenny Nguyen to introduce our keynote speaker.
All right, hi everybody. All right, so good afternoon, campus community. It is with great honor to introduce our keynote speaker, Dr. Sarah Cody. Dr. Sarah Cody joined the County of Santa Clara Public Health Department over 20 years ago and serves as both health officer and director of the Public Health Department. In her dual roles, she oversees more than 30 programs dedicated to providing services that prevent disease and promote health and equity for nearly 2 million county residents. Dr. Cody was born and raised in Palo Alto. She attended Palo Alto High and later Stanford University. After receiving her medical degree from Yale School of Medicine, she became a resident in internal medicine at Stanford Hospital. She completed a postdoctoral fellowship as an epidemic intelligence service officer with the Centers of Disease Control and Prevention. She is also the immediate past chair of the Big Cities Health Coalition, which represents health leaders from the 30 largest cities in the county who collectively serve 1 in 5 Americans. Dr. Cody ordered the first stay-at-home directive in the nation. She created an incident command center just days after learning the first COVID-19 case in the nation. She developed a contact tracing program in efforts to contain the outbreak. She went on to galvanize with other health officers in the 9 Bay Area counties to work together and with a common voice. With her team and multiple community partners, she has focused on health equity in underserved communities by making vaccines readily accessible. This year, the Palo Alto Chamber of Commerce and the Palo Alto Weekly honored Dr. Cody with the Tall Tree Global Impact Award, only the 3rd year the award has been given in 42 years. Many of us have pursued this degree with the intention to make a difference in the communities we serve. In the last 2 years, we have seen the impact of public health and watched the world learn about the importance of our work. We are lucky to have such an extraordinary public health leader before us who has shown us what it takes to turn good intentions into measurable impact. So please join me in welcoming a true cornerstone in public health, Dr. Sarah Cody.
Thank you so much. That was very, very sweet. And thank you for inviting me today and for thinking of me to come and join you in this celebration. It's a true honor to congratulate each of you and to celebrate with each of you in getting your MPH degree. So greetings to your families, your partners, and your communities who have supported you, and thank you to the faculty and the program for guiding you towards this day. So you are an exceptional class of MPH students. You have balanced school with family and your studies, and you have persevered in the middle of a worldwide pandemic, and that is no small thing. Can you hear me okay? There we go. Each of you has so much to bring to our field of public health, and it's not just because of what you've studied to get your MPH, but it's also because each of you will bring your individual knowledge, your lived experience, and your expertise to your work. And as you all know, public health is local. And when you know a community, when you co-design strategies, and when you share power and decision-making with community, that is when we can be most effective. And to do that, you need to build relationships. And from relationships comes trust, and not much happens without trust. So today I want to talk about the importance of trust, which together with humility, empathy, and respect is a key ingredient for effective public health. And before I start telling you a little pandemic story, I want to acknowledge just the extraordinarily difficult time that we are in our country in this moment. And I know that we are all weary of the pandemic and weary of unrest and weary of uncertainty. We've lost 1 million lives to COVID. Just imagine if every single person living in the city of San Jose died in the last 2 years, because that is what has happened. And in fact, this city, the city of San Jose, was ground zero, and the very first of those 1 million COVID deaths was a resident of San Jose. So we're grieving not just those who we have lost in the pandemic, but we are also trying to grapple with mass shootings, opioid addictions, climate change, and many long-standing and seemingly intractable societal problems, all in a very diverse political environment. But I am still hopeful, and I think you all can be hopeful too, and I'm going to tell you why. We can't forget that with these challenges, with every challenge, comes an opportunity. And all of these monumental problems can be made better with a public health approach, with thoughtful, strategic, multi-layered, and incremental change. Just think of our progress with so many public health successes. Think of clean water. Think of what the advances we've made in smoking prevention, motor vehicle safety, and locally, at least, I think, with a pandemic. So we can apply these things to address these other problems. And with the pandemic, public health has new visibility. People now understand what is public health. And before that, they might not have understood how central public health is to health. And also, when you work in public health, you will never, ever have to wonder if the work that you do is valuable and important. You will never have to wonder if you are spending your own precious time and talent on something that is important. You will always have that with you. So back to trust. I want to share with you a bit about my pandemic experience and how I thought about the decisions that I made, and illustrate for you how trust was so central to the success of our response. So the whole pandemic was one of firsts. And personally, I had to transition from being a somewhat reserved and in my comfortable behind-the-scenes role to a local public figure. And in this, I experienced both adulation, which was lovely, and a no small amount of harassment. Suddenly, I had a Wikipedia page, a dish in a local restaurant that was named after me, an interview on the Rachel Maddow show, a shout out in Vogue, and random people stopping me on the street to express their gratitude. But also, for the first time, I've been extensively bullied and harassed. I've had protesters at my home, death threats, 24/7 security detail for me and for my family, social media trolls, and for a moment, I was the #1 trending meme on TikTok for licking my finger during a press conference while I was telling people not to touch their eyes, nose, or mouth. And that is why I'm wearing a mask, because I have many pages and I don't want to lick my finger, okay? So, to start our local pandemic story, I want to take you back to January and early February of 2020 and walk you through my decision, along with my Bay Area colleagues, to issue the first shelter-in-place order in the country. So the end of January, January 23rd, we activated our Department Emergency Operations Center, and this was because we thought, yeah, we're probably going to see cases on the early side. And this was because we understood that our county, an incredibly diverse county, people from our county have family and friends all over the globe and travel a lot, whether for personal reasons or for professional reasons. And second, I'd seen this before, because in 2022, 2 of the 8 confirmed SARS cases in the entire country were in Santa Clara County residents. By February 2nd, we already had 2 travel-associated cases reporting, but of course, they were travelers returning only from Wuhan, China, and so that's all we were finding, because we were only allowed to test travelers returning from Wuhan, China. But our phones were ringing 24/7 with calls from concerned physicians caring for patients with fever and respiratory symptoms who were returning from travel to other areas of China and the world. So by then, in early February, we had a terrible feeling in the pit of our stomachs, but our state and federal partners continued to communicate that the risk to the public was low. Was it? We didn't really know what the risk was. We simply didn't have the data and tools to tell us. On February 4th, a colleague and I sketched out a table on a large wall post-it. This is public health, right? We don't even have whiteboards. It's large wall post-its. And we entitled our table, "Are We Different?" And on that day, the US had recorded 260, quote, persons under investigation, or PUIs, and in our county, we'd already recorded 14, or 5% of them. The US had recorded 11 confirmed cases of COVID, and we had already recorded 2. So in other words, nationally, 6% of PUIs became confirmed cases, but in our county, 20% of our PUIs confirmed. Or another way to look at it, we had 11% of the total cases in the country at that moment, but we only made up 0.6% of the population. Tiny numbers, okay, tiny numbers, but enough to make us worried. The next day we updated our chart and the numbers were still small but still striking, and we looked to be in trouble. On January 5th, San Jose resident Patricia Dowd died when the left ventricle of her heart ruptured. She was the first known COVID death in the entire United States. Although she died on February 6th, we didn't know that her death was from COVID until mid-April. On Friday, February 7th, the first EUA, or emergency use authorized lab testing kit from CDC arrived in our public health lab. Our lab director stayed up all night, and the next morning he said, "We're good to go." But when he tried to test real patient samples later that day, he noticed something was amiss. And he called us very concerned. But he said, all the labs are experiencing this. The negative control, it's not working. By Monday morning, February 10th, we were officially told to hold off on running any more tests. And remember, this was the CDC test was the only test that we were allowed to run and use, and we were told that we needed to hold. And so we held and we held for 3 very long weeks. And it was this period of feeling blind, just this excruciating limbo, and very eerie. My colleague in New York described it as being similar to the time in a horror movie right before the alien jumps out. On Wednesday, February 26th, we were given the go-ahead to proceed and use the lab tests. We got the first 2 samples in our lab and reported our very first positive. So really almost the very first sample that came to the lab tested positive. And this positive became our 3rd case. She was a woman in her late 60s, and she had no known travel history. So she was our first case of community transmission, and we announced that on a press conference on Friday, February 28th. And that's the press conference when I was extraordinarily nervous, because I wanted to talk about the risk to the public health in a very honest but very precise way. And in my nerves, and I had typed out my press notes so I could speak, word for word, I moistened my finger unconsciously, and that became the meme. So now that we could run our tests in our own lab, we started to test more broadly. And although our tests were very modest, the more we looked, the more we found. And we began to see a pattern that looked like exponential growth, but the signal was still quite fuzzy. So we decided that we needed to conduct a quick and dirty surveillance project. We needed some way to really understand prevalence, to get better clarity and understanding of what was happening. And so the first week of March, between March 5th and 14th, in 4 urgent care centers, we tested anyone who came in with flu-like symptoms but was negative for influenza. We ran it for SARS-CoV-2. And what we found was 11% of those 79 samples were positive for SARS-CoV-2. And this was a key data point for my decision. So those were the facts that we had in that moment. But there was another important conversation, and it was a conversation I had actually with my husband sometime in February when we were taking our dog Alfie on a spin around the block. And I have the good fortune of being married to someone who is a professor of health policy and does infectious disease modeling, so that was very handy. And he reminded me about how exponential growth works. And also reminded me, of course, that if I did anything big and major, it was going to have extraordinary economic and social harms. However, if it was done early, it would have enormous benefit, and done even a few days later, a lot of the benefit would be lost. So if I was going to go, I would need to do it fast. Looking back, actually, I think that we had enough evidence to issue a shelter in place earlier than we did, just based on case counts alone. But I wasn't ready, and there were 2 things that held me back. First, I really needed that prevalence data from the clinics to feel like what I was worried about was really what we were seeing. And the second and really important reason is that emotionally, I just wasn't there. I wasn't there yet. I just couldn't believe that this was happening. It felt too surreal. On Friday, March 13th, I gave a press conference to announce that I was prohibiting gatherings greater than 100 people. And I actually choked up during the press conference. In the moment I was saying this, I was thinking about all of those things that couldn't happen and what a profound effect this was going to have on people's lives. So many things that wouldn't, so many activities that couldn't occur. And at that time, on Friday, March 13th, we knew of 66 cases and 1 death. 48 hours later, on March 15th, our cases has almost doubled from 66 to 123, and we had 2 known deaths. So in addition to our doubling of cases and that surveillance study that I told you about, I also had a table of cases in Italy and in Santa Clara County, and we looked to be about 2 weeks behind where Italy was, and I knew that their hospitals were overwhelmed and that many people were dying. I also knew, based on my discussions with my husband and the dog, that if I was going to go, I needed to go fast. And I also understood that no one else was going to make the call. The California Health and Safety Code places that responsibility with the local health officer. So on the morning of Sunday, March 15th, quite early, I got a text from my friend and colleague in San Francisco, Dr. Tomas Aragon. And he texted to say, can you just quickly hop on a call with me and our health director? So I did, and he just wanted to make sure that the Bay Area counties were aligned on the cutoff for large gatherings. Should it be 30 or 50 or 100 or 200? It was getting frustrating, right? Because all the counties were doing something different. And so Tomas and I briefly talked about who else we should bring on the phone to hammer that out. And then we quickly realized that we were asking the wrong question. So we went over the Italy data again, and it was clear to both of us that Santa Clara County did look just like Italy had 2 weeks prior, and what we needed to be doing was discussing shelter in place.
So by noon that Sunday, we convened 5 of our colleagues from around the Bay Area, and we also invited the Santa Clara County Council and Chief Assistant County Counsel to join us and listen in, because we wanted to make sure that our public health law colleagues knew exactly how we were thinking and would be ready to craft a legal order. So there were conference calls all day, and they culminated in a very late night, large conference call with the health officers, multiple attorneys from every county, and county executives from the 7 jurisdictions. And we had some waffling and pushback about the time. Many worried that we were just moving too fast, and couldn't we take a few more days to think about this? But we trusted our public health knowledge, and we trusted our public health instincts. I don't actually recall anyone questioning whether we needed to issue a shelter in place. Really, it was only about the timing. Our county council stayed up all night crafting the order. We polished it up and finalized it mid-morning on Monday, held our press conference at noon, and the order became effective at a minute past midnight on March 17, 2020. So I just want to stop and reflect and think, how were we able to act so quickly? And we were able to act at the speed of trust. And I can't emphasize how important that is. We spent years building trust with each other, the Bay Area health officers. There's an association of Bay Area health officials called ABAHO that was formed in the 80s, really born of the HIV/AIDS crisis. And the health officers and health directors came together to understand how could we better align ourselves, understand what was happening, and serve our collective community. And during non-crisis times, ABAHO health officers, we meet every other month and have dinner. So this is a group of people that I've been having dinner with for many, many, many years. We all know each other extremely well and have a high level of trust and respect, even though we don't always agree. And that is what allowed us to act in less than 24 hours on a Sunday. So of course, the aftermath of the shelter-in-place order, for the first few weeks it was relatively quiet, but then the drama began and it never stopped. And reopening turned out to be much more complicated and extremely messy as compared to the original order to shelter in place. But I think a central challenge for us is that the tools that we needed to shift from this very broad strategy to one that was more focused, they weren't coming online fast enough, not nearly fast enough. So for example, we didn't have widespread testing till the middle of that summer, as you may remember if you were trying to get testing. We weren't able to scale up case and contact tracing for a number of months, not until the summer either. And there was also widespread PPE shortages. I remember when we didn't even have enough masks for healthcare workers, and that went on for a very long time. And we, of course, certainly had no vaccine and no oral treatments to offer. And finally, we also didn't have access to state and federal funding to make people whole. So people weren't working, people were not able to support their families, and we didn't have enough funding to support them in the way that we should have and we needed to. So to me, it felt like we had no choice but to run an ultra marathon, but we had no food, we had no map, and the conditions were treacherous. On other days, I felt like we were flying a plane, but with, no instruments in bad weather and just hoping for a crash landing. But through it all, we did stick to our guiding principle, which was equity. So it was apparent by late March, early April, that we were seeing much higher case rates and mortality rates in certain communities, particularly in East San Jose and in the Latino community in general, and in other areas of the county with structural impediments to health and really very little capacity to absorb any shock. These, of course, are communities with lower income, often with crowded and multi-generational housing, and lots of household members working in essential sectors. So I thought about this a lot, and I did not know how else to protect the most vulnerable except to keep the overall community transmission rates low. And with few other tools available at that time, that meant keeping a lot of activities on hold. Also, these communities are not isolated. Household members are working in every sector, and many working in long-term care and other health facilities. And other communities had started to experience outbreaks, usually starting with a staff member, and we wanted to prevent that as best we could. And yet, I would say that we were able to work most effectively actually in East San Jose, which was our hardest hit community. This community, as many of you know, particularly if many of you grew up in the community of East San Jose, home to many immigrant families, and many families have an understandable mistrust of government. Public health has invested years in building relationships with community leaders and resident leaders while working on a violence prevention program. And this trust that we built enabled us to work alongside community leaders and ensure that testing information, vaccination, and whatever new resource was available to as many people as possible in the community. So before I close the pandemic story, I just want to reflect on a few lessons learned. One is the effectiveness of our local response was limited. We were able to be nimble and quick in our local response, but local effectiveness can only go so far in a global pandemic because, after all, we're not an island. And the lack of state and federal policy alignment was deadly. The needed resources and actions by other branches of government simply didn't come in a timely way. And we couldn't, as I mentioned earlier, hand out money to small businesses or restore paychecks or pay people to quarantine at the county level. Second, public health emergencies aren't democratic. It's a bit more like a wartime situation, and that you need rapid action to protect the public. So I think we have to look to our political science colleagues to help answer the question of what would happen if public health emergency decisions were left to local elected officials. Not only are public health actions during an emergency not democratic, they are also, just to be clear, the polar opposite of how we usually operate in public health, which is by carefully engaging our stakeholders and making collaborative decisions. So we did do that in parallel. I did do that in parallel with issuing these crazy undemocratic orders, really sort of like the polar ends of what we do in public health. But finally, I just want to emphasize again the importance of trust. So our early collective action was the result of the trust that we had built with each other, and the effectiveness of our local response reflected a population that for the most part respected and trusted their local government and leaders to act in their interest. People believed us when we told them they were in danger. And as you know, trust takes years to build, but it fractures very easily. So in closing, graduates, as you embark on your career in public health, know that there will be times that feel unknown, uncertain, or even scary. But remember that we have all felt this way, and eventually you get a little more comfortable with those feelings. And remember too the paradox of public health, which is that when we are doing our job really well, what you will see is nothing. And that's great, because we're about prevention, and that means that we prevented that bad thing from happening, even if you can't see it. And preventing that bad thing from happening is how public health can change individual lives, as well as communities and the world. So public health needs you now more than ever. Public health needs your passion and your lived experience and your expertise. We need you now more than ever to be the agents of social change in your communities. And with the knowledge and experience that you all now have, I trust that each of you is well equipped to serve your communities and take the next step in your careers that will make meaningful change for all of us. So heartfelt congratulations to each and every one of you, and know that you always have a welcome home at the Santa Clara County Department of Public Health. Thank you.
Thank you so much, Dr. Sarah Cody. This is a gift to Dr. Cody from the graduating class. So thank you very much for your inspiring words and for all the work that you do to keep our communities safe. Whew, that was very extraordinary. That was really, as a public health person, I'm very inspired right now. So this is a really good time then to acknowledge our graduates, which is what I'm sure many of you have been waiting for. So at this time, we would like to begin hooding our graduate students and acknowledging them. So let me tell you a little bit how it's going to go down. Dr. Dugan will have the honor of hooding our graduates while the rest of the faculty, our keynote speaker, and our chair will form a line to congratulate you with a celebratory elbow bump. Please make sure to hand your hood to Dr. Dugan and turn around to face the audience while she places the hood over your head and smile for the photographer and all your family and friends. Are we now ready to honor our graduating students? Well, then I ask them to rise and start coming to the stage, and we shall begin. Yes. Yes. Perfect. First, I would like to call Ana Acosta. Yesenia Cárdenas. Michelle Chen. April Cox. Brenda Flores. Jesús García Alvarado. Alejandro Hernández Chávez. Sheira Iran Manesh. Jenny Nguyen. Alexandra Orlando. Elizabeth Roman. Junu Shretha. Andrew Somera. Melissa Trujillo. There are graduates who were unfortunately not able to be here with us today. However, we would like to honor them. Minu Sonali, Vasundra Mehta, Harneet Kaur Ranata. I would like to ask the graduating class to please rise, and we give them one last round of applause to our students. You may now sit down. Now I would like to ask Dr. Berkowitz to join me in presenting the MPH Program Awards. So a little bit of context. Each year, the MPH faculty goes through the process of determining the awards for the graduating class. The faculty collect data, we are researchers after all, on how students did in their analytical and writing courses, and then the MPH faculty comes together to finalize the remaining rewards. It is our honor to present the awards for the 2022 MPH Campus Program graduating class. Please come to the podium and receive your award. The first award is for the Outstanding Writer Award, and it goes to Yesenia Cardenas. Take a picture. The next award goes to Harneet Kaur Ranata for the Outstanding Analyst Award. Unfortunately, Harneet is not with us today. Next, we have the Honors Distinction in the Comprehensive Exam, and this goes to Michelle Chen. Also receiving the honors distinction on the comprehensive exam is Harneet Kaur Ranata. Next, I would like to present the awards for service to the MPH program. As I mentioned earlier, a group of very committed students met for the last couple of months to put this event together. So today, we would like to recognize the service to the MPH program and as part of the graduation planning committee to Ana Acosta. Mixing it up, I like it. Next, I would like to call April Cox. Next, I would like to call Jenny Nguyen. Next, I would like to call Melissa Trujillo. The next award I would like to present is for extraordinary service to the MPH program. Shada Iran Manesh. Shada has been working with us tirelessly as the MPH Student Association Treasurer, as well as basically getting us this Student Union Theater and all the details that go with it. So Shada, please receive your award. So that concludes our service awards. Our next award goes to, is for the Graduate Student Researcher Award, and that goes to Harneet Kaur Renata. The next set of awards are very special to the MPH program and are really based on our founders of our program. The Helen Ross Award is for somebody who shows extraordinary just practice in public health and health education, and that award goes to Jenny Nguyen. Our next award is the Sam Rattlefinger Award, and it goes to Out of the Box Thinking, and to the student, Andrew Somera. Now for our last award. This award is called the Eyes on the Prize Award. And it is for a person who has fought really hard to be here and to make it through our program while juggling 1,000 things. And this goes to Elizabeth Roman. Gotta get the outfit right.
I'm so excited about the prize. Thank you.
So thank you for honoring our graduates today with their awards. Now I would like to call, well actually before we do that, just please join me in congratulating all of our students for their accomplishments throughout the program. Now I would like to call to the stage the graduating students who will be sharing the public health commitments they all developed as part of their leadership course this semester. As they embark on navigating the world as public health practitioners and recent Master of Public Health graduates, they promise to honor the commitments they have made to themselves, each other, and the communities they serve. I would like to call to the stage Melissa, Shada, Jesus, April, Jenny, Michelle, Andrew, Liz, and Brenda.
Hello, everyone. Our first cohort commitment is, as public health leaders, we commit to practicing cultural humility with everyone and being aware of our assumptions and biases.
As public health leaders, we commit to fostering and creating equitable access to health care for all communities to thrive and prosper.
As public health leaders, we commit to a system of prevention for all that will enrich the lives of communities who have struggled in the past, present, and future.
As public health leaders, we commit to developing community capacity through intentional collaboration, ongoing and sustainable partnerships, and continued education and learning.
As public health leaders, we commit to advocating for social justice and working towards health equity by recognizing the impact privilege, oppression, and structures of power have on the health and well-being of the communities we work with.
As public health leaders, we commit to evaluate our current efforts to improve the health of the community and always prioritize the improvement of our future interventions.
As public health leaders, we commit to becoming lifelong learners and ensure we are up to date on the constantly evolving social, political, and environmental issues to support those requiring assistance.
As public health leaders, we commit to promote diversity, inclusivity, and empowerment to ensure that everyone that is needed at the table is there and represented so that we can increase their capacity to thrive.
As public health leaders, we commit to ethical justice, integrity, and honesty because we value peace, morality, and authenticity.
Thank you so much to all of our students for sharing their public health commitments. I would now like to ask Dr. Dugan to the podium for her closing remarks.
Thank you, Dr. Gomez. There is a well-known African proverb, "It takes a village to raise a child." I also know that it takes a village to raise a scholar. Your loved ones have supported you throughout your program, providing a space for you to share your triumphs and challenges, maybe even to vent about a certain professor. Graduates, please rise and honor your village. Your cohort will always have a special place in my heart. For one thing, You're the only cohort so far I never taught in person, and I will look back fondly on all our technical mishaps. I know Andrew won the award for out-of-the-box thinker, but I tell the story to this day when my internet died and I had to teach Zoom on my phone, but Andrew here was driving the class for everyone, so I'm glad he got the out-of-the-box award. But what I will remember the most is the way you always took care of each other. That came through very clearly, even on Zoom. And if you take even half of that into your profession as public health practitioners, the world will be a much better place for all who cross your path. I now leave you with a quote from the great Dr. Maya Angelou. I may have even shared this with you in class. You may encounter many defeats, but you must not be defeated. In fact, it may be necessary for you to encounter the defeats so that you can know who you are, what you can rise from, and how you can still come out of it. Congratulations, class of 2022. Celebrate this moment, for you have earned it. We are proud to call you colleagues and are excited for what the future holds for each of you. That concludes our celebration today. We have a photographer here. We have a photo booth that's out in the lobby. Please come and congratulate your graduates. Thank you so much. I'm like, Aaron, cue the pop music.
Hello, everybody. If possible, can we get the whole MPH cohort on the stage so we can get a group picture? Graduates, MPH graduates, please, on the stage so we can get a group picture if you're still here. Yes, with the faculty here. All the MPH graduates on the stage, please.
Thank you, Anna.
Yeah, no problem.
We'd like to call April Cox to the stage. We'd like to call April Cox to the stage. We'd like to call April Cox to the stage, or if one of the volunteers could find April out in the hallway, that would be great. I'm like, Melissa, I'm looking at you. Great, thank you. Don't forget your
Exactly.
case.
The eye.